Lords, it's a great pleasure to follow the Noble Lady and to ensure that a full cross-party from all round your Lordship's House, including the government benches, support for Amendment B1 has been presented. I will just say that the Green Group also supports C1, particularly strongly D1, F1, G1 and L1, but I'll only speak very briefly to B1 because it is so crucially important. Now, the Noble Lord the Minister, in introducing this group, spoke about, as the government often does, the record numbers of staff in the NHS. Well, I don't think anyone's yet mentioned the NHS staff survey conducted from September to November. Just 21% of nurses and midwives thought that there were enough staff in their unit to do their job properly, to provide an adequate standard of care. 80% thought there wasn't enough staff. And Noble Lady Baroness Tyler referred to the Ockenden report. And what that helped to highlight was the fact that despite the fact the government has been trying to recruit more midwives, in the last year the number of midwives has actually gone down. Now, I really think we have to ask ourselves the question why the government is so opposed to this amendment when there is such strong support for it around this House and indeed around the country among all of the key bodies. Now, it may be that the government has an ideological objection to the word planning. Maybe the Noble Lord the Minister has an ideological objection to the word planning. But this is about the future of our NHS, and all of the experts, all of the evidence says that this is an essential amendment. Surely the government is not going to let ideology stand in the way of the future of our NHS. And I just want to finish by commenting on the wonderful introduction to this group, this typically wonderful introduction to this group from the Noble Lady Baroness Cumberledge, who referred to the very strong civil society campaign. The hashtag for that on Twitter is strength in numbers. And I think that says so much. We need the numbers, we need the facts, so we can get the numbers of staff in the NHS.